Hello there, thank you so much for joining us on Asonye Live this beautiful evening here on Kaftan Television. It's wonderful to know you're back there watching us. Now, it's a wonderful thing to have you. However, Nigeria is battling with something very important, very unfortunate as well. Nigeria currently faces similar challenges as its citizens indulge in drug and substance abuse, despite the Nigerian drug policy adopted to guard against inadequacies in drug availability, supply and distribution. There are several NGOs and foundations across Nigeria doing something to mitigate all of this. And in the studio with me is Mr. Charles Olufem. He is the coordinator, Joint Task Team on Drug Prevention, Treatment and Care. He's also the Executive Director, Reorientation Advocacy of Nigeria. Thank you so much for being part of the program.
Thanks for having me. It's nice to be here again.
It's nice to have you. You've been very busy trying to reduce and consolidate to reduce drug harm, of course. We'll go for a short break now to return to get into the crux of the matter. How can we consolidate to reduce drug harm and dependence in Nigeria? Well, promises to be an interesting interview, so stay tuned. We'll be right back. Welcome back from that very short break. It's nice to know we can get into this very important issue today. Like I said earlier, we have Charles Olufem, Co-Executive Director, Reorientation Advocacy of Nigeria. He's also the coordinator, Joint Task Team on Drug Prevention, Treatment and Care. Now let's just get into the matter. Can you provide an overview of the current situation of drug dependency in Nigeria and maybe some other challenges associated with it?
Yeah, basically, we rely on the several research, conducted by organizations with interest on drug abuse in Nigeria, including the National Drug Law Enforcement Agency, and of course, United Nations Office on Drug and Crime, as well as WHO, which is World Health Organization. The current statistics which we're using right now shows that over 14.3 million Nigerians engage in drug abuse on a daily basis. And we have over 3 million Nigerians living with drug use disorder, and more than 20 million people suffering from mental health challenges. And this is alarming. The population of Nigeria, so unfortunate or more of concern to us, is that most of these populations are young people, all right, and women, and concerned about involvement of adolescents. So for us, this is a major concern for us as an organization, and this is what led us to take up this issue of drug prevention, treatment and care for our program this year, and of course beyond. And basically, when you look at the issue of drug abuse, we're not just concerned because of drug abuse, but because this also is a precursor to a lot of challenges. Major challenges confronted by Nigeria as a country today are challenges traced to drug abuse among young people. You could call it, looking at the education sector, a lot of young people lack concentration and could not even stand up to expectation in classes, because of drug abuse. When you go into economy, most of the young Nigerians are not stable enough to contribute meaningfully to economic development of the country. Are basically employed, but are not really employable, such that what they are given into the system, the level of productivity is very low. We'll talk about the health. A lot of young Nigerians, male and female, are suffering from several diseases relating to, kidney disease, heart disease, liver disease, and all of this that are traced to issue of drug abuse. And the most sadden part of it is that a lot of young Nigerians involved in a lot of insecurity and crimes and criminality, insurgency, banditry, and most of them, when you look at it, of course, if I must take it up, a member of the Nigerian Correctional Service has said that more than 80% of those who have been convicted for crime are people who are on drugs. So these are issues that Nigeria must look into holistically, and this is why we're taking up this. Looking into the issue of drug abuse, I think, is what the country must do, and that's why we're doing this. Yeah.
Now, a lot of NGOs are in that space trying to do what they can, but would you say that this prevalence is because of the provision of data or statistics, as we say, at this moment, or there's always been this prevalence? Because it seems like it's in our faces. A couple of years ago, the BBC had a report that showed the dire situation of members of the public who are drug dependent and the rehabilitation. But before we get into rehabilitation, let's talk about statistics. Is it that we are having prevalence, and why are we having prevalence, if that's your response?
Well, you must put something into consideration, is that the Nigerian population continue to grow, and young people continue to engage into a lot of activities that have been introduced, most of which, many of them are getting through social media, many of them are getting it through their friends, many of them are faced because of issues, they are facing in their life, in their family, unemployment, poverty, marital issues, and the rest of them. However, the prevalence itself, our concern is that despite the efforts of organization, I mentioned UNODC, they've done a whole lot of work in Nigeria as regards to drug abuse, especially the reduction. And when you look at the NDLEA, of course, the NDLEA led by General Buba Marwa, doing fantastic jobs in terms of trying to work on drug demand reduction, at the same time supply reduction. However, for NGOs, just like you mentioned, most NGO works on the drug demand reduction. For us, we've been with the NDLEA for some years now, basically since 2019, working on drug demand reduction. However, the statistics seems not to be coming down, because as much as we are putting, it needs more than advocacy. So this is where it comes. A lot of organizations today engage in advocacy on drug abuse. Fantastic, that's good. However, there's a need to shift, our ground into focusing on treatment and care at the same time while we're working on prevention. When you have millions of people living on drug use disorder, it's a problem. And one of the best examples to show the people who are already in drugs is to see how we are leaving people out of these issues, how the people are being reformed and becoming a better person in the society. This is naturally appeal to their minds. So for us, this is why we came up with the, looking into, National Drug Control Master Plan 2021 to 2025. There is emphasis on drug prevention, treatment, and care. So we pick this aspect of it and then look into stakeholders that we can work with, so we can reduce the level of prevalence. And they brought everybody together: the Federal Ministry of Health, the National Drug Law Enforcement Agency, the NAFDAC, the National Primary Care Development Agency, of course, even National Agency on Control of AIDS. And interestingly, we got the buy-in and the support of the current Inspector General of Police, Mr. Kayode Egbetukun, who expressly support this initiative and nominated members of police force into becoming part of the team of what we are doing. So we are working with the Nigerian police force as well, and I think this is the first kind of it in Nigeria, for us to bring together stakeholders. People are working on their various organizations, but it's important for us to have synergy, so we can look at this issue holistically, starting from looking into survey assessment of issues, looking into some pilot stage we're going to work, and bring out the typical example of what we want to do to Nigeria. So the prevalence is there, we must see. The statistics, seems to be reducing, but this demand the effort of all of us, as citizens, the traditional leaders, the religious leaders, the political leaders. Everybody must be ready, to support the issue of reducing drug abuse in Nigeria.
I'm happy to just talk about a collaboration with the law enforcement agents. I know in certain climes across the world, there is the breathalyzer, where you can tell that this person is driving this certain way because of the influence of some certain substances. Yeah. In Nigeria, do we have that? So when the policeman sees a crime being committed, how is he able to say? Because I've not seen breathalyzers by this law enforcement agent. So while it's a wonderful initiative by your organization to bring in the law enforcement agents, what much can they do?
Okay, well, thanks for that question. You see, when you look at the issues that we're having to show drug abuse, it's unfortunate that institutions of governments are terribly affected. The research has shown that in the military, when you go and look at it, there are issues of drug abuse. The military are disciplining their members through marshals because of the issue of drug abuse. People in the military are being dismissed because of issue of drug abuse. And when you look at in the issue of the police, We have had issue of extrajudicial killing, mishandling of firearms, you know, and that was traced that the people mishandling these firearms are under the influence of drugs and substance. So this is why it is critical for us to carry along everyone, and we're not just doing it for the public. First, we are trying to purge the institutions themselves, looking into what is happening in this institution. How can we purge the police of member of the Nigerian police using drugs? How can we purge the Nigerian army? How can we purge the Nigerian police, the Nigerian Navy and Air Force? How can we go into Nigerian, you know, civil defense corps and see that the people that are supposed to be law enforcement are not the people violating the law?
Right.
This is the first assignment. When we can do that, and we can all gently now work to see how we can now help the society, because you can't help the society if you cannot help yourself. So this is why it's critical. And when you look at this, we, like we said, we're working on drug, you know, the demand reduction. Reduction and we don't really need the force. And we are trying to make it for us to see these guys that on, you know, living on drug use disorder or having issue with drug use and addiction should be treated as patients, not criminals. Yes, we have to change that perspective.
Exactly. Yes. I know that the NDLEA has been doing a lot when they get somebody who is dependent on drug and addicted to drugs. They treat these people as patients. But that brings me to another segment of this conversation, where we have to talk about the treatment in Nigeria. How many rehabilitation centers do we have? What is the quality of these facilities? Because like I mentioned earlier, we had all seen that BBC report that showed the dire situation where these people were being treated. They were chained, they were flogged. It was the most horrific thing anyone could see. What are you doing as an organization very interested in you know, curbing drug harm to ensure that there is indeed proper rehabilitation for these people with professionals who would ensure they come out with the dignity? I mean, not the floggings that we saw.
Yeah, that's good. You know, when you look at the current situation, we must appreciate those who have been putting effort into rehabilitations of people living with drug use disorder and addiction in Nigeria over the time, and those who are solving the issue of mental health. Yes, there are efforts in Nigeria, both from the government and of course non-governmental organization and private institutions. However, if we are where we are supposed to be, maybe we will not need to be taking this up. The holistic look at the rehabilitative exercise in Nigeria shows that we are far below where we should be, and this is what took us as an organization, as part of our research and efforts to implement this program. We reach out to organizations across the world, and we're lucky to have a foundation called Amon Foundation in the United States of America that is being run by Nigerians and Africans in the diaspora. And we reach out to them, we look into what we can do together, and fantastic, they brought on board people that are specialists in the rehabilitation and of reintegration of people living with drug use disorder and addiction. And many of them, one of them fantastic in Nigeria, is a Nigerian doing very well in the United States, who has been head of hospital, who has been CMO in hospital in America, and the person of Dr. Nelson Alia. He has done a lot of work. He's been speaking about drug abuse in Nigeria. He's written a lot of articles to ensure that this is addressed. And when we reach out to him, he embraced this and said, look, this is what we must do for our country. And since the time we have been talking together, he has been contacting other colleagues across America to see how we can collaborate together to rescue the situation in Nigeria. This is a fantastic step we have taken. And what we're looking into is to introduce world-class rehabilitative exercise, activities into Nigeria in a way that, because as it is right now, the rehabilitation in Nigeria, the level of success is very low. We have done research to see that a lot of people who are coming out even from rehabilitation centers are still going back into this society. So we look at it holistically, not just to do rehabilitation in the world of rehabilitation, to have it holistic approach by having rehabilitation, all right, and be able to give them post-rehabilitation empowerment, engagement, and job, placement in a way that when they come out of this, they can become useful to themselves, to their society, their family, and to the country at large. So we put together all of this. Of course, there will be no time for us to really look into show us the plans that we have. But I must be sincere with you, it's a holistic plan. Taking it to in fact, we have prototypes that was introduced by, by our partners that were, from abroad, in the way that a rehabilitation center should look. And we have shared this with all the partners we are bringing together. We have shared this with them. We have our stakeholder engagement on the 5th of December 2023, where all of us agree that we should form, the joint task team to work together, because in all the rehabilitation exercise, you can see the role of everyone.
There.
So you don't just play your part and leave it.
Exactly.
So everyone could come together. Everyone will do this together, and this is what we are doing right now. Just like we said yesterday, we had a fantastic meeting with the Ministry of Health. The Minister.
We'll get to that meeting.
Okay,
we get to that meeting. However, you just mentioned the diaspora contributions to the fight against drug dependency in Nigeria. However, Nigerians will tell you that before this globalization, before this free access to the internet, we didn't even know the many other drugs we could take. And it's because of the global access to information and the entertainment industry. It seems like we are normalizing the use of drugs. Our entertainment industry, you see people brazenly using drugs and singing about it, telling you about it. It now makes it something to look forward to, and the peer pressure as well. But it goes back to this diaspora people. While they have good intentions for Nigeria, a lot of people are very skeptical about what the intentions may be, because now bring this thing come. You're the one who have exposed us to very hard drugs. Would you agree with that?
Well, I disagree, and I will back it up by statistics.
Because if you go to statistics, the US is having a serious drug problem. For instance, the UK has its own, and not to mention several other top countries around the world.
But in Nigeria, our case is a bit different. It's unfortunate that most of the drug consumed in Nigeria are not those ones that are really imported. Nigerians are devising means as we speak to build their own different kind of concoction, I'll call it. You will have heard of colos. You heard recently how people are sniffing toilets. You heard how people are using lizard, to get high. These are not drugs that come from outside. The issue we should ask ourselves is, why are they engaging in these activities when people are doing a lot of things? If we talk about marijuana, like you said, it's been grown in Nigeria. It's not imported. And I can say, if you look at it,
it's however illegal, however
it's illegal, but it's also used pharmaceutically. It is when it is taken unprescribed is what is abused. All right. What are we saying in essence is, when you look at marijuana, it's like a popular drug as we speak in Nigeria. However, while we are waiting for government to look into how best way this can be controlled, we are doing our part as organization to see how we can convince the mind. If you feel that this thing is useful for you, is it prescribed? The answer is no. All right. When you feel that somebody is using it and you are using it as well, do you have the same structure of of body and heart? The answer is no. And when you look at other drugs, just common drugs are being used, for common ailment, are being abused in Nigeria. So when we talk about drug abuse, it is not that some of these drugs are not drugs that are consumable by human. Some of them are actually consumable, and if they are consumed in the right way, it's not an abuse. But when you are using it without prescription, and you are turning it and you get addicted to it without prescription, there is an abuse. So when we talk about the issue of drugs, people can talk about there's a kind of drugs that are being introduced internationally. Yes, those ones are just one. They are just a part of what we are talking about. So the issue of drug abuse goes beyond what comes from outside. And when you talk about the social life of the young people, and we have said it is part of the research you have looked into. Today, an average young Nigerian will not have things to do when it talks about social world.
Right.
You end up either in clubs or in a garden where people are smoking and drinking. So the peer pressure comes in. The journey gangs comes in. And that is why we have to look into our social life as a country and see what we can introduce to the society that the young people will be able to do without necessarily becoming addicted to drugs, or without necessarily going into some gateway drugs. All right. So it's not about the issue of international. When we talk about diaspora, don't forget, most of these people we are talking about, they are Nigerians.
Of course.
Because they live there, so they understand what is happening. In fact, like I mentioned, most of them are telling us that they don't want Nigeria to become the situation that is currently happening in America.
Right.
So we can't afford it as a country. We don't have the level of health facility and infrastructure to withstand our young people, majority of our young people, going into drugs and dying of it. We can't survive it. So we can't even compare ourselves to that, and that is why we must look into it critically and ensuring that this doesn't go, out of control. As it is right now, it's going out of control, and we just must do something about it.
Well, it's time to go for a short break. When we return, we'll be talking about the engagement you've been having with other agencies of government and other collaborative stakeholders. When we return, we would also delve into what can be done. We're seeing this prevalence even in secondary schools, colleges. It's unfortunate. Stay with us. We'll be right back after this short break to get into all that we have to. Welcome back from that short break. Like we said earlier, we've been discussing consolidating to reduce drug harm, and in this studio is Charles Olufem Folayan. It's been interesting having him talk about what Nigeria can do to reduce all of this. But recently, he's been having several intervention meetings and engagements with government officials, stakeholders around the advocacy against drug abuse. We would get to how he's doing. There is a reception from these agencies of government and similar organizations such as his own. Would also get to what we were talking earlier, talking about the diaspora, talking about young people in as much as secondary school being introduced to this, and the northern the northern part of Nigeria, where it seems there's a high prevalence of drug abuse. What is being done? Like I told you, there's so much to discuss. Olufemi, we're back again. Let's get to this engagement you've been having. I mean, on the program recently, we also reported that you visited the Ministry of Health and Social Welfare. How was your reception?
Fantastic. You see, first we must appreciate the vision of the current president of Nigeria, Asiwaju Bola Ahmed Tinubu, who have not only made us to have Ministry of Health, but also making now Ministry of Health and Social Welfare. And the meeting we had with them brought out this clearly, that the ministry is not just only focusing on addressing the issue of health of Nigeria, but overall well-being as regards to the social welfare of Nigeria. And this is why we are keen into partnering with the ministry. We believe that the president, of course, you making that ministry now Ministry of Health and Social Welfare, have fantastic plan into how we can address the issue that are affecting Nigerian, especially as regards to their well-being. And when you look at our meeting with the ministry, it was clearly stated. First, we must appreciate the minister as well, in person of Professor Ali Pate, who gave us sweet response, to our request to have partnership with the ministry and to have meetings, with them. And of course, this they did by sending a representative, into the joint tax team to be part of what we are doing, to make the input of the ministry, and to let us have a sweet collaboration. And the recent meeting was for us to concretize and harmonize our plans in terms of partnerships, and of course to seal it up by having physical meeting with the leadership of the ministry, which was represented by the permanent secretary of the ministry, Madam Daju, who expressly expressed the interest of the ministry to work with us to ensuring that what we are doing succeeds, and who also mentioned the aspiration of the president, Bola Ahmed Tinubu, especially some intervention programs that the president has initiated in collaboration with the 36 state governors to ensuring that we have issue of health in Nigeria addressed. So we are keen to that. We are partnering with them. The ministry has been there as policy making ministry who understands everything that is happening across Nigeria. They have data, right? They have the history. They know where the work is ongoing. They know where the work you need us to be intervened. And that is why we're partnering with the ministry. And the ministry has assured us of, of continuous partnership and support, for Nigerians through our organization. So I can assure you it's a promising collaboration. And in few days, we're going to be shooting out from different states, which we already have as pilot states, in collaboration with the ministry, like I mentioned earlier, with the National Primary Care Development Agency, with the National Drug Law Enforcement Agency, and of course all the Nigerian police force that are ready to work with us.
That's interesting. Now, some people would ask, we are seeing prevalence among very young people. We're talking teenagers who are still susceptible to peer pressure to get into the drug use in the first place. What would you say your organization is going to do, maybe prioritize to ensure this, we curb this and nip it in the bud?
Well, it's a sad one that we now have the issue of drug abuse among young people in secondary, in primary school. That's as sad as that, among adolescents and young people. Now, what we are doing as an organization, we have factored this in to see what we can do, and that was why our implementation strategies, include us establishing, our caregiver and advocates in schools, in religious centers, in communities, to continue to do sensitizations, for the community, to continue on advocacy, to continue to show good example or mentoring the young people. This involves, bringing in teachers, guardians, parents, pastors, imams, afars who are directly relating to people, to be part of what we are doing. And that's the part of the success, we are working on, to have that our implementation strategies and encapsulate every strata of the population in a way that when you go to church, you hear about what we're talking about. You go to mosque, you hear about it. In school, you hear about it. In your community, you hear about it. To know, the implications of engaging in drug abuse. It's unfortunate that adolescents are involved. And of course, it's a matter of public conscience, important, because we can't afford to destroy the future that are coming far behind us. So we must, as a matter of public conscience, important, start to rescue the future. And that's why we used to say that we can't build the future for the youth, but we can build the youth for the future.
Now, are there notable cases or studies that shows a success when it comes to drug dependency interventions that have worked? It seems like you take one step forward and two steps backwards. The family, are they doing enough? Do we have, or Gen Z parents these days are like, you know what, it's hip, it's a trend for my child to come home all hazy-eyed, or teary, as one of those telltale signs to look out for. But it seems, do we have these parents who are as dedicated to know what's going on in their children's lives? In those days, I mean, you and I, when you come home and you smell funny, your parents want to know why, Do we still have that evaluation and that nitpicking parent?
Yes, I must say that we must understand that, yes, the society is fast losing the value of the society. And this has made it for us to have a lot of parents and not parents. However, I must tell you, there are so many good parents out there who are watching out on their children. But for our own responsibility, one of the things we are doing is to ensuring that we do training, like we mentioned, especially on early signs that the parents will watch out for in their children. It's part of our strategy, our implementation strategy, for us to carry along parents to be able to have early signs, to be able to know what I watch out for my children or my daughter, my son. When they start looking like this, when they start doing these things, what should I know? Who should I call to? And that is why we are making it holistic. When you have those early signs, what do? We have been working, like I said, on the issue of drug demand reduction with the NDLEA. I will be overwhelmed with calls. People call us to say, oh, I need rescue. I've seen my daughter doing this. I've seen my son doing this. So, but we have less facilities. We have less opportunity to be able to help them. That's why we have to go out to say, look, we need to build more capacity. We need to enlarge our codes to be able to respond. There are parents who are definitely working on it. And when you talk about if there have been, progress, yes. We must give it to, like I mentioned, the UNODC working in Nigeria, the EU working in Nigeria, the World Health Organization, and our own NDLEA. A lot of work has been going on. And NAFDAC, of course, we must mention. So what we are now doing now is to be able to put ourselves together, to be able to do it more better, for effective and efficiency. But I must say that the previous, we can't say we have totally lost. However, the situation is currently overwhelming, and it demands all hands to be on deck, and that's why we're here.
I must commend you for the work that you're doing to ensure that all hands are indeed on deck. But you just mentioned several organizations that are partnering with this, and that the fact that you get several calls to this. But what are the intentional initiatives you're putting to really address it in that, especially very young ones?
Okay.
The primary school, the secondary school, and why are we having this prevalence? It's really concerning.
Okay, so what we have put in place as part of implementation strategy is to partner with some states, government, and stakeholders in the states. Currently, we are of course in partnership with Lagos State government, with Katsina State, First Lady, Kebbi State First Lady. We are partnering with the Bayelsa State government, and of course Benue, and looking into other states where we are going to be working with in short time. For these states, we have reached a logical partnership agreements to be able to implement the project in the various states, and we're going to be doing that with all figure we can muster. We're going to be engaging all stakeholders in the states to see how all of us can put on deck to ensure that this issue is tackled headlong. And we're so confident that with the strategy we are bringing, which of course I will not be sharing it on air.
Right? Why not? And I mean, I want to know what strategies it is, and I'm sure people listening would want to know.
I'm not going to be sharing it on air. It's just simple and understanding. The issue of drug abuse, if you're not careful, is you're going to be seen as enemy of the youth. However, we are not enemy of the youth. We're actually the friend of the youth. So the more you devise and talked about the strategy you want to use in copying this, the more those who doesn't want it to end continue to define that strategy. Like I said, we are strictly facing those who are suffering from drug use disorder and addiction. We are strictly facing the issue of prevention in terms of advocacy, in terms of training. We are strictly facing the issue of treatment in terms of both psychosocial help and support, in terms of therapy, in terms of medical treatment,
right.
And in terms of post-rehabilitation engagement. And that's why we have also been engaging the National Director of Employment, because we understand, like we said, government cannot just give young people employment. If you give young people employment and these young people are distracted by drug abuse, the employment, they will not add value to the system.
That's true.
They're not going to contribute to the organization they're working for. They are not going to contribute to the level of productivity. So it is not just about giving young people employment. We must be concerned about the mindset of the young people, their frame, their mindset, their frame of the mind, their level of brain, their psychological stability, their mental health. We must consider all of this. So if the government want to help the young people, one of the first things is to ensure that their mental health stability is key. The first thing to ensure is that this person is thinking rightly and he knows what he's doing. There is no point handing over gun to a young person who is a drug addict. The guy you want to protect the society is going to use that gun to destroy the society.
That's true.
And that is why it is important in every hand. Nigerian police force is currently recruiting young police. The recruitment exercise is going on. Nigerians want to see people who are coming to the system to help to secure the country, not those people who are going to be in the system and will be misfiring and will be destroying the society.
Well, Olufem, I mean, a simple Google search would expose several videos of Nigerian policemen that are under the influence. We've even seen NDLEA staff that are under the influence. That's not the story for today. Let's get into treatment. And most concerning is the fact that sometimes when you see these young people who are dependent on drugs start exhibiting certain tendencies, and the family notices these tendencies, instead of looking for a rehabilitation center, they go to religious leaders. Is that something you would also address? Because it's quite concerning, because the religious leaders may be not even knowing what's going on. also would push the narrative that some witch is following this person from the village, or there's a spirit that has consumed this person, and it goes longer instead of being addressed at that time. So are you also having in the stakeholders, I mean, when you say stakeholders, you talk about several agencies that do the same work that you do, but these religious leaders and traditional leaders, have you considered having that holistic conversation with them?
Thank you very much. You are more sounding like a researcher as well. The issue that you're talking about, people, thinking about the issue of drug abuse is either spiritual or not. That was why in designing our implementation strategy, we also carried on religious centers, like I mentioned earlier. So if we have advocates in these churches, if we have those who are caregivers in these churches, by the time they see someone who is falling under the influence of drugs, they already know that this is what is happening to this person by their training.
Exactly.
And they can refer them to the appropriate coaches. So the person will not be wasting time staying and be thinking that, oh, it's one evil spirit. That the evil spirit disturbing the young man or woman on the floor is in his pocket or her pocket. So we need to identify that. And these are the areas we're definitely going to be working with. It's holistic, like I said, and as we are speaking, as we are going on, we're going to be carrying along other institutions that are willing to work with us. What we're trying to do is to make sure that we can do this all together, not trying to divide it. That's why in our implementation strategy we talk about for us to have easy flow of work and to have the synergy that works. That's why we're here.
Right, let's talk about this prevalence of drug dependency in the northern part. It seems like it is highly alarming when it comes to segmenting where it's worse. Why is it that in the north, and what are you doing, especially because from where I come from, they are very conserved, and so you need to be careful how you reach out to them. These women who are often shielded from the public are now known to be using. So it's really concerning. How are you going to address it? I remember the permanent secretary also telling you that we need to do something about it, especially the women from the northern part of the country. So how are you going to balance it impactfully?
All right, thank you. When you look at the issue that are causing the issue of drug abuse in the North Nigeria, let me say, as the statistics we are currently using, the drug prevalence and the level of drug abuse is higher in the Southwest than even the Northwest or the Northeast.
Really?
As it is now, the state with the highest level of prevalence is Lagos. Okay. And then when you come back to that, yes, there are reality on ground. Because when you put together drug and substance abuse, then Lagos comes first. But we put together... But
then again, you have to also put into cognizance the population of the country.
Yes, that's what I'm coming to. And when you put in some set of substance abuse and drug abuse, then the North come first. But this issue, when you look at the northern Nigeria, in a lot of places there are restrictions for people engaging in alcohol consumption in the public and the rest of them. I don't want to preempt our research. I don't want to bring up right now this is what is causing the issue of drug abuse in the North and Basic. As part of our implementation strategy, we're carrying out survey assessments, to come up with particular data in each of the pilot states to see exactly what is causing the issue of drug abuse. But it is something that is obvious to everyone that there are a lot of women in the North and youth engaging in drug abuse. And it's a matter of concern. 2 weeks ago or thereabout, the former president of Nigeria, former President Muhammadu Buhari, raised an alarm in Katsina and said that there is a lot of the issue of drug abuse among the young people, and we must do something to it right now. The president in his statement was trying to urge, the government of Katsina that there have to be serious engagement of young people, especially, young youth, male and female. To an empowerment, to ensuring that they don't go into the issue of drug and all of that. Just like many of these young people, when they have nothing engaging their hands, when they have nothing doing that is engaging their mind, they think of what next is to go into drug. But like I mentioned, it is open that this issue is already a menace, whether in the North or in the South. Yes, you could say some state and higher than some state, but this issue of drug abuse is everywhere in Nigeria as we speak. So we cannot isolate it to say, this thing is so much in the North. As you are talking, it's happening somewhere, in some places.
Exactly.
And following the statistics and data that we have, like I mentioned, Lagos still have the high level of prevalence than other parts of Nigeria. So when you pick Lagos and you come to other states, you go to the north, you take Kano, you take Gombe in the north east, and the rest of them. You go to the south, it's everywhere. So what we are trying to do is to ensuring that we can tackle this issue headlong, whether in the north or in the south.
Okay. Yeah. Well, we're talking about prevalence and looking to the future. What innovative or strategies would you suggest? I mean, young people that are often in the internet all the time, and we're also seeing that those who they have coined as role models or molded as role models are often brazenly talking about their involvement in this, and not necessarily in a way that discourages, but more like, I am hip, I am trendy because I do this. So how are you going to tackle it in the entertainment industry? Our movies and music in music videos often show drug use as something to look forward to.
Well, that takes me to, one of our strong supporter and member of our advisory council mentioned basically that if we have to tackle the issue of drug, his own advice is that we really need to partner, work with, the entertainment industry. And of course, we're already taking steps in that regard. We're going to be working with them into ensuring that we can build role model amongst them. When you look at the NDLE recently, even was appointing some of
as ambassadors against drug use.
Yes. However, while that is very good, we are trying to also have some of them who are living good life, who sees no reasons to publicly come and engage in drugs, to tell the rest of them why his own decision is best for the country.
You can be talented without having
that. And one of our slogans is that we can catch all the phones without drugs. All right? You can have all the fun in this life without drugs. So when you look at it, some of these people in the entertainment industry are probably following trends, all right, which is called social trend. However, we can create a better trend. Role modeling is key in our society, and everywhere in the world, the entertainment industry, especially the movie industry, is supposed to be shaping the society.
Exactly.
It's supposed to be introducing society ideal norms, values that people should see and embrace. Unfortunately, without apology, while we recognize that there are actually some of them that are playing very good role in building mentorship and in being a good role model for the society, we disagree with some of them, with what they are doing to the society. And of course, we believe that Nigerian Constitution recently, the government appointed people into the film censor board, into different agency of government. We want to see what they're going to be doing. We want to see what they're going to be giving into society. We need to have an ideal society, not just because people are following it, because someone will tell you that, look, if we don't do those things, the public will not follow us, the public will not buy into us.
It's
but it is not just about the resources you want to make from what you are doing. What about the damage you're going to be causing into the society? So this has to be looked into. And that's why, like I said, we are going to be collaborating with the people in the entertainment industry, where, with the musicians, with the Nollywood actors and actresses, to see how we can work together and end this together. Fantastic. You see some of the movies, some of them deliberately are even preaching against drug abuse in some of their movie. And we must give it to them. We watched a movie recently from Toyin Amaku, who basically in our series was preaching against drug abuse. And those are the kind of people we wanted to be role model to the society, and many other people.
Well, I must commend you again for what you're doing. It's quite interesting. And then, since we're talking about consolidating against drug harm, there's so much facets to it, and that's why it seems like we're taking sector by sector.
Right.
Another very important part of what goes on is these young people who are susceptible to taking in drugs. They don't mind, ingesting it just so that they can travel for I mean, it's crazy what happens in the airport when we report these cases. But young people are still susceptible to this. I don't know what they are promised, but very often, oh, you can swallow this, and then when you get there, you can excrete it, and then we can sell it and all of that. But young people still are susceptible to this trend. What can we do so that we will not have this any longer? And that brazen attitude of people still trying to push drugs, I don't get it. With so many people arrested in the airport, is it that there are still success stories that give people the effrontery to still say, oh, I will hide it under some luggage and nobody will see it? In this technology where you can see through your bags, what's going on in that aspect?
For us, we have not really made research into drug supply reduction. That is currently an exclusive role of the National Drug Law Enforcement Agency. But for us, for the young people who are engaging in the issue of drugs, like our organizations who is partnering with every other organization, is reorientation advocacy of Nigeria. It starts from reorientation. Exactly. It starts from education. And that is actually the brain behind the organization itself. If the young people don't get the right education, they are prompt to any slight usage. They are vulnerable to being used against their country, against law, against society norms. And that's what we're doing as an organization. We'll do reorientation massively to ensuring that we can bring young people into the right thing.
I'm smiling because I just remembered something. But we've been having this conversation with Charles Olufem. He's the Executive Director of Reorientation Advocacy of Nigeria, also the Coordinator Joint Task Team on Drug Prevention, Treatment and Care. I'm smiling because I just remembered some years ago, not very long ago, whenever you talk about RAN, you're talking about politics. Well, I'll just say thank you so much for political orientation. Yeah, thank you so much for being part of the program. And I'll just urge my viewers, if you want to hear more about RAN and how we have now transcended from the political orientation to drug now, I think I'll be bringing you back to talk about your political experience. It would be nice to know what happened in your political experience. We've been advocating for young people, giving opportunities in governance and all the bottlenecks that often affect them. But it's wonderful to see you so passionate about this drug fight, the drug addiction and prevalence fight. Thank you so much.
Thanks for having me. Thanks for the opportunity. And happy New Year to all the members of your station, to your chairman. Thank you.
Thank you so much. Well, my name is Joy Asonye. We've had a wonderful conversation talking about consolidating to reduce drug dependency and harm. But this is where we roll the curtains on this week's edition. Just like you, I'm sure you're going to have a restful weekend, and I'm looking forward to that. Let's Netflix and chill. Until next week when we come back again, have a wonderful weekend.